As many Americans head home after the holiday weekend, we wanted to get more information that can help you stay safe. So let's turn to our friend, Dr. Ashish Jha, the Dean of the Brown University School of Public Health. Dr. Jha, thank you for joining us.
Thank you for having me back.
So I wanted to say, looking at the numbers, I mean, sometimes it seems as if everybody is getting infected with Omicron. I mean, we're just like, I'm sure many people in your life, we're seeing public figures, friends, neighbors, people are getting infected at an alarming rate. That has some people panicking, but not you. So explain why. Why aren't you at a more alarmed level of concern about this?
Yeah, so first of all, it is concerning. I mean, obviously, infections are spreading quickly. They're rising very, very rapidly. And if this was March of 2020, I'd be panicked. I'd be terrified. It would be a very bad situation. It's not March of 2020. What we're seeing is two sets of things. We're seeing a lot of infections in vaccinated people, but because they are vaccinated and many of them boosted, these infections are very, very mild. And that's the big saving grace. And the second, and the part that does concern me more, Jonathan, is that we are seeing still obviously unvaccinated Americans getting infected at very high rates. And that's the group I'm worried about, because that's the group that's going to end up in the hospital. That's the group that's going to end up in an ICU. So we really have to look at this in a very different light. For vaccinated people, this is a very different infection than for the unvaccinated.
So let's take first the vaccinated people, because one thing that we're seeing, it seems to me at an alarming rate, are breakthrough infections, and not just with people who have been vaccinated, but people who have been vaccinated and boosted. Why are we seeing so many breakthroughs?
Yeah, so Omicron is a virus, it's a variant that has a lot of immune escape. All of those mutations you've been hearing about means our antibodies just work a little bit less efficiently. And so if you get a high enough dose of this virus, it'll break through that first wall of your immune system. But your immune system has a second wall, which really prevents severe illness. So if we think about all of these cases we're hearing about, most people are reporting kind of a mild cold like symptoms, a couple of days of feeling lousy, and then they get better. That's the vaccine working. Omicron, the biggest part of it is all that immune escape is leading to a lot of breakthrough infections. Less among people who are boosted, but still a problem. But it's not leading to significant consequences for those who've been vaccinated.
So, I mean, really, since the start of this pandemic, the number that we've tracked, in addition to obviously hospitalizations and deaths, but the number that we've tracked has been infections, new cases. How many new cases are? That's been the leading indicator of how bad things are getting, or how effectively we're dealing with the pandemic. Are we getting to the point where that indicator really isn't the one that matters? I mean, if new cases, as you said, among the vaccinated are not leading to serious sickness, is it an indicator that we should really be paying so much attention to?
Yeah, I think this is the most important part of this moment in this pandemic. We have to do a shift. Look, for 2 years, infections always preceded hospitalizations, which preceded death. So you could look at infections and know what was coming. Even through the Delta wave, that was true, because it was largely unvaccinated people who were getting infected. Omicron changes that. This is the shift we've been waiting for in many ways, where we're moving to a phase where if you're vaccinated, and particularly if you're boosted, you might get an infection. It might be a couple of days of not feeling so great, but you're going to bounce back. That's very different than what we have seen in the past. So I no longer think infections generally should be the major metric. Obviously, we can continue to track infections among unvaccinated people, because those people will end up in the hospital at the same rate. But we really have to focus on hospitalizations and deaths now.
And among the unvaccinated, do we have a sense of whether or not this is as dangerous or significantly possibly less dangerous than Delta? Because you did see those numbers out of South Africa, and South Africa is a country where the vaccination rate is much lower. The population's younger, but the vaccination rate is much lower than the United States.
Yeah, this is the big question, and it's obviously critically important. What we know about South Africa is they just had a massive Delta wave over the summer into the fall. So a lot of those unvaccinated people have just recovered from an infection. So the question is, what about people who've not had a recent infection and are not vaccinated? How will they do with Omicron? We don't have very good data. It is possible that it might be a little bit milder. Obviously, I hope it'll be a lot milder. But I don't know that we have data on that. And right now, it's reasonable to assume that even if it's milder, it's not milder enough. We're still going to see, I think, a lot of unvaccinated people end up in the hospital.
So we've seen that the booster seems to be quite effective in at least preventing the severity of disease, even with Omicron. Obviously, the data is still coming in. But what about those who are still, we still have, younger people in this country who can get the vaccine but they're not eligible yet to get the booster. How concerned should those be? The people that are 16 years old and younger. How concerned?
Yeah. So first of all, it is absolutely essential that if you're in a higher risk group, you get a booster. That to me feels like just critically important. But for you, the question that you ask about younger people, healthy people, I'd like all of them to get a booster. I think the data on adults getting boosters has been crystal clear since the end of August that all adults need one. If you're a 16, 18-year-old relatively healthy person and you have not gotten a booster, you're also protected, in large part by age. That if you have a breakthrough infection, you're just going to be very mild anyway. So I'd like to have every adult get a booster, but to me, the most important priority, of course, is getting the high-risk individuals boosted.
So, and we've seen some countries, South Korea, the United Kingdom, Thailand, Germany, that are shortening the length of time when they're recommending boosters from 6 months down to 4 or 5 months. And in fact, we've also seen Israel is talking about a fourth shot, I guess a second booster. What do you think of either of those ideas? A shorter time period for getting the booster, or are we going to need to be getting kind of an infinite number of boosters here?
Yeah. So first, let's talk about shortening that time period. I think it's actually pretty reasonable. The data suggests, both for Moderna and Pfizer vaccines, that shortening it to as little as 3 months, but probably more in the sort of 4 to 5 months range, because we do see a waning of the immunity of the antibodies by 4 or 5 months. That'd be a pretty reasonable thing to do. The problem is we don't have a good mechanism to do that. Like FDA and CDC usually wait for the companies to file. It can take months. We saw that with the booster rollout. I would love to see our agencies move forward on a shorter timeline. It will make more Americans eligible, and I think it will make more Americans protected. On the future of more boosters, I think we don't know at this point. Is it possible we'll need more boosters? Possible, maybe even likely. When I think about it, I get an annual vaccine for the flu. I guess I get an annual booster. I think that's fine. The question is, are we going to need something more frequent than that? I haven't seen any evidence yet that we will. Let's see where Israel goes with this, what their data shows, and then we can make decisions based on that.
And as we go into the new year, I don't think any of us expected to be in the situation we're in now, where we're seeing, increasing numbers of people infected, worries about hospitals possibly becoming overburdened in January, particularly in areas where people have fewer people are vaccinated. What though is your view? Look into your Dr. Ashish Jha crystal ball. What does 2022 look like? Is it the year we finally get this thing under control, or are we in this for the long haul?
Yeah, I think it is definitely the year we get this under control. And let me explain why. I mean, this holiday season, no one thinks that this is the holiday season we were hoping for. But contrast it to last year, it's so much better. Well, next holiday season, I doubt COVID will be completely gone. Actually, it won't be gone. It'll be endemic. It'll be around. But it'll be much better than this year, because while the virus continues to change, so do we. We're building better tools. We now have Paxlovid, the new Pfizer pill that'll be widely available, hopefully by earlier part of this new year. That'll be a really important tool. More people will get vaccinated. Unfortunately, a lot of people will get infected, but that will build population immunity. We'll have more variants. I'm actually convinced that we'll have more variants, but each of them will impact us less and less. And we will get to a point, certainly by the end of this new year coming up, we will get to a point where we'll see new waves of infection. It will not have a big effect on hospitals. People will go on. People will not get really sick and die. And we will learn to live with this virus, and it will stop being so disruptive to our lives.
All right. Well, thank you for bringing us a hopeful note here at the end of 2021. Dr. Ashish Jha, appreciate your time.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.